Good morning, everyone. My name's Carla Macias, host of Austin's own medical show, Best Docs Network, featuring one of the top medical facilities in Texas, and that is Forest Park Medical Center, where it's your destination to better health. We've got a great show for you today. We'll be featuring some of today's current health topics, as well as some of the latest procedures offered by some of the best physicians here in Austin. Let's get today's show started with bariatric surgeon, Dr. Michael Lee.
I was a skinny kid. I've always been a skinny kid until I hit puberty, and then I slowly started to pack on the weight. College, eventually, I hit my highest weight I've ever been. Once I tried on my wedding dress and had to struggle between sizes and alterations and never really have it fit right, then I knew I needed to do something.
Alexandra's a patient who had been seeing a GI doc for vague abdominal pain, and it was unclear whether she had a problem with her esophagus or her stomach. I'd seen her in clinic, and she was telling me about how she had been overweight her whole life. I felt like if she could get enough weight off her midsection and decrease the amount of intra-abdominal pressure and getting rid of that obesity, essentially, that would in effect help out her reflux disease.
Dr. Lee laid out that I probably should get the gastric sleeve instead of gastric bypass because I wasn't as overweight if I continue with the weight gain instead of... I feel really good. I've never felt better. As of the day after surgery, I had no acid reflux and no indigestion. I'm shocked how much the weight loss has caused me to feel the energy I have. I thought Dr. Lee was really personable, easy to get along with. I'm a very visual person. He drew out every procedure. I like the fact that he does my learning style because then I can know exactly what's going on.
It's kind of a tradition in our industry to have a celebration when the building tops out. It dates back many centuries. But really what it means to us on this project is it's just recognizing that we're about halfway through on the project, we are on schedule, and it's to thank the workers for all that they do to make this sort of thing happen. It really doesn't happen without them.
Basically, it's to thank the construction workers, the architects, the planners. We also want to thank our physician investors. They've obviously put a lot of effort, a lot of time, money into building this hospital.
Every day that goes by that I have a case that's delayed or have issues at other facilities, I just look forward to the day that we'll be able to be here in a beautiful facility and make it run the way it should be run.
I'm really excited about this project. Looking around, I can tell that this is going to be a beautiful state-of-the-art facility. And I'm really excited with the concrete steps that we've made in the progress.
We're extremely proud of the project team out here to date. They're doing remarkable on the schedule. The design has been flawless. Right now we're on target to deliver the building in February, and all crews are working hard.
We hope that this will be a project that is very meaningful to the patients of Austin because there's no question that to the doctors this is a game changer.
This is our 6th hospital we've done with Forest Park in the past 6 years. So it's been a great experience to have a partner working in an environment of trust and respect and really a true partnership.
They have a great safety record here that we're really proud of. And in fact, when I came walking up, I didn't have a hard hat on, and somebody said, "Hey, get a hard hat on."
I can't tell you how exciting today is. Just getting closer and closer. I can't wait for this place to open.
For physicians, it's all about what you can touch and feel and do, especially for your patients, and to actually see the building coming up around us obviously is very exciting.
We've gone from a dream and goals to actually really seeing things starting to happen now. Can't wait to get in here and get started.
Forest Park Medical Center is a different kind of hospital, designed for warmth, designed for comfort. Forest Park Medical Center is your destination to better health.
So cholesterol, what's my goal? It used to be we look at the total cholesterol number and shoot for under 200. Well, it turns out that doesn't tell us enough information. So what we do now is subdivide the different types of cholesterol into LDL, HDL, VLDL, and there's a lot of subtypes. But the big one to remember is your LDL cholesterol in particular. The goal used to be less than 130 across the entire population. And the more we study this, the more we think that lower is better. If you add in at least one cardiovascular risk factor, which would be, let's say, diabetes, now your threshold drops to 100. If you start adding in multiple comorbidities such as diabetes, high blood pressure, sedentary lifestyle, overweight, male sex, all these things are all risk factors. Now we start to push that LDL cholesterol even lower with the goal being under 70. Overall, those are some good sort of ballpark numbers to talk to your doctor about. HDL cholesterol, the goal for that one is to keep it over 40 or 50 depending on what study you read. And the single best way to bring up your HDL cholesterol is exercise, the ugly word nobody likes to discuss. But it really does pay off for a number of reasons.
The doctors over at Forest Park Medical Center, Austin, are always finding new ways to get involved in their community here locally. Up next, we're going to take a look at how some physicians from the Texas Fertility Center teamed up with the Susan G. Komen race to not only help spread awareness on breast cancer, but also ways that women can preserve their eggs while undergoing cancer treatment.
The most rewarding part about Texas Fertility Center being affiliated with Susan G. Komen is the ability to really get back to the community and to promote awareness of this aspect of what we do. So every year we have a big group, a big team that comes together. We associate with several other OBGYN groups in town who have staff members and physicians that all join the TFC team, and we have t-shirts just like all the fun teams do, and we go out there and support the cancer survivors as well as all the women and families who have someone who's struggling with cancer now.
We're just so excited to be a part of this race. The Komen Foundation is a very important foundation, and what they've done is phenomenal for so many people. And we're very proud to be associated with them. We're very proud to be members of Doctors for the Cure. And we're so happy that we can get such a big team out here under Wendy Blocker's direction, who is one of our marketing people, and she is just an incredible motivator. And she's done a great job of building team spirit and building so much excitement around this race. And this is something we do every year. And again, we're just so happy to be associated with the foundation and to be a part of the race.
I think the race is already a huge success. You just look out here in the crowd and there are just all these people and families and friends together celebrating all these great survivors and honoring the people that have lost their battle of breast cancer, but we're all doing it together, and I think it's great. We've got a lot of people and a lot of excitement, and it's great.
This is our third year to sponsor the race, but the last 2 years are really the 2 years that we've had big teams that have showed up en masse, where we'll have 80 to 100 people on the team. Our employees, their families, we have patients that walk with us. It's really, really a good celebration of life.
I think this race is fantastic for survivors and their families because it encourages hope. It gives them something to look forward to every year, and it's just a reward for their travel, their journey, what they've been through, and to be able to get together and celebrate with their families, with their community, and with other people that are still on this journey. It's just a day of celebration for them. So this race does all of that.
It's a beautiful day. We're out here support of Komen GFIT Foundation, and I'm personally running for my mother-in-law, Linda Wilson, who's a 5-year survivor. Komen Foundation does so much for counseling our patients and their families who have or are facing breast cancer. They provide a tremendous amount of resources, and they help us in counseling our patients, specifically for fertility issues when it comes to breast cancer and diagnosis.
We have a really unique relationship with Susan G. Komen, in that probably close to 10 years ago, the oncologist in town started aggressive therapy for women who are young who have premenopausal breast cancer, and it has a very, very high cure rate. But unfortunately, some of that aggressive therapy that results in a cure can also cause significant problems with infertility down the road. So we worked with many organizations, Komen in particular, in really trying to promote fertility awareness and particularly fertility preservation awareness. And we are set up to do elective egg freezing, elective embryo freezing, where individuals or couples can come in and say, you know, we're faced with this treatment that is going to be ongoing for maybe the next 3 to 5 years, and we don't want to lose our opportunity to start a family. So we have the ability for women to be able to freeze their eggs prior to initiation of therapy, particularly if it's a therapy that's likely to render them infertile down the road, or for couples to retrieve the eggs, go ahead and fertilize them, and then freeze embryos so that as soon as they have the green light to attempt pregnancy, we're ready to go.
Tracy has a question for Dr. Haro. If my child has a fever, when is it a good time to go to the doctor?
Children with fever is a very common situation. Parents have to ask themselves if they feel that their child is significantly different than normal. Even if the fever is low, 101 for example, in a toddler. If parents feel like their child is very sick, excessively cranky, or they have other worrisome symptoms, say a long-term cough, vomiting, refusal to eat or sleep, then they need to see the doctor.
Smartphones and on-the-go technology are on the rise, causing Americans to use headphones more often. But did you know that wearing headphones for just an hour could increase the bacteria in your ear by 700 times? If you're ready to request an appointment with any of the doctors you've seen on today's show, head to our website, bestdocsnetwork.com. You can do this by clicking on Austin under the Our Doctors tab. Now, one of those doctors you can find on our website is pain management specialist Dr. Genaro Gutierrez. Dr. Gutierrez will be discussing radiofrequency ablation for knee pain.
I had total knee replacement on November 19th of 2013. I did physical therapy, work conditioning. I overstretched the ligaments on the inside and the outside of the knee, causing the knee implant to be loose. I was having a lot of nerve pain. Pain level from 1 to 10 was in the 7 to 8 range. My surgeon suggested pain management.
So the issue with Stephen was he underwent a total knee replacement. Unfortunately, his hardware hasn't quite settled in yet, and his surgeon's hope was that it would settle in over the next few months. I suggested that we do the radiofrequency ablation on his knee because the life of the radiofrequency ablation is typically anywhere between 6 months to 2 years.
I drive an 18-wheeler, so as a truck driver, I'm in and out of the truck, up and down on the loader all day. Being as I'm doing so much movement, it radiates a lot of pain off of my knee, radiating all the way up to my hip. And it's causing a lot of problems after I got home. I was having to over-medicate with pain meds. Dr. Gutierrez and I decided that doing the radio frequency on my nerves would be the best option for me because I am a truck driver and the activity I have all day long to get in and out of the truck.
Radiofrequency ablation is a very focused beam of energy that is emitted from the tip of one of these specialized needles. What that does, in turn, is it turns that energy into heat. When that heat is created, it will lesion some of the tissues around it. The idea is if you know where your nerves are and you lay the tip of the needle right up against that nerve, you destroy that nerve. That treatment can last anywhere from 6 months to up to 2 years.
After I came into the recovery room, Dr. Gutierrez had me walk and I had no nerve pain whatsoever. I like Dr. Gutierrez, I really do. You can ask him questions, he'll explain about the treatment, how he was going to do it. I would suggest anybody with chronic pain contact Central Texas Pain Management, mainly Dr. Jerry Gutierrez.
What it means for Forest Park to be a part of the Austin community. We're just really excited to be here. We feel very honored that the surgeons have asked us to be a part of the Austin community. It's a great opportunity for the surgeons, it's a great opportunity for the patients in the North Austin medical community. What makes Forest Park different from other hospitals in the Austin area and even throughout the U.S. is that we're a truly physician-owned hospital. We are governed by the physicians who are the majority owners. So the physicians have a lot of say-so in the day-to-day operations of the hospital, from the medical staff to the OR and to the equipment that they want to have as part of their hospital that they own. We have 3 existing hospitals that are open right now and 3 under development. They're all truly unique. Every hospital serves the physicians that are participating in the hospital. Every community has a different need, and so we will serve what Austin needs and what our surgeons need. Each hospital is like a 5-star hotel, so that when a patient and a family member walks into the hospital, you really don't think that you're in a hospital. It's not a cold, sterile environment. It's very warming. You feel comfortable there. The patients' rooms are very spacious. They're very beautiful. Some of the hospital rooms actually have a VIP suite attached to the patient room. That room has a flat screen TV, a refrigerator, a pull-out bed, so family can stay overnight. The caliber of physicians that we have at Forest Park, we think are some of the best that Austin has to offer to patients. The estimated number of physician partners we have right now, we have 70 in the partnership. We have 12 different specialties involved in our specialty mix. We hope to add additional partners in the near future, as well as additional specialties. We bring the best surgeons to our hospitals. We have the best staff, we have the best service. We feel like the best hospital that Austin will have. Forest Park Medical Center is truly one of a kind.
Dr. Ned Snyder is a plastic surgeon and reconstructive specialist here in the Austin area. Now let's hear his methods on practicing medicine.
From the time that a patient becomes engaged with our office until the completion of their breast reconstruction, when in many cases that can be complicated. We may see somebody at the very beginning of a cancer diagnosis, and we may not finish them until after they've had what can turn into a lengthy process of treatment. And we're with them the entire time. I think that we play an important role in their cancer treatment. And I think we take a lot of pride in that, and the sort of customer satisfaction end of it, or customer service end of that, but also in outcomes. And that I think that we have exceptional outcomes, and I think that our patients are extremely happy with the product. So I think it's important, and I tell this to all patients, that I'm going to stick with them all the way through. And then some patients come to us with complicated problems that they're not as straightforward as a new cancer diagnosis and a reconstruction at that time. They may have had failed reconstructions from other places, and I'm going to stick with them until they're done, and I promise them that from the start. So I think that that's an important tenet of kind of what we represent, or what we do here.
Forest Park Medical Center is a physician-owned medical facility that is being hailed as a 5-star hotel of hospitals. One of those Forest Park physicians is Austin urologist Dr. Stephen Hardeman. Dr. Hardeman will be discussing kidney tumors with one of his patients. Let's take a look.
I was in good health, and I started urinating blood. Went to the emergency room. The emergency room doctor said, let's get a CAT scan. And she came back and said, do you have a urologist? I guess it's pretty easy to diagnose if you have a spot on your kidney, it's a tumor. Finding out you have a tumor is a scary thing. I didn't know what kind of cancer, was this going to be something that was going to be life-ending? When I was talking to Dr. Hardeman, he went over a lot of options, but they all boiled down to the best thing to do would be to take the kidney out.
Kidney tumors are a little unusual in that they still remain a surgically manageable disease. There is no very effective radiation therapy or chemotherapy for kidney cancer. So when they're discovered, the primary therapy is surgical removal of the kidney cancer. Normally when we remove somebody's kidney and discover that there's a tumor there, we have to follow them up for at least 10 years. And that requires monitoring with things such as chest x-rays, blood tests, and recurrent CAT scans to make sure that the tumor hasn't recurred. As far as a cause of kidney cancer, we've been trying to find out for many decades now. We haven't identified a specific cause.
My recovery process was really unexpected. There was very little pain. I was up walking the next day. I've been clear for a year since the operation. I'm doing good. I have no metastases, no signs in my laboratory work of any problems, and I certainly feel good. I feel real good. I would go back to Dr. Hardeman because I like the way that he talks to me, the way that he's thorough, he's straight from the shoulder, lets you know what's going on and what your options are. By guiding me like that, I think my wife and I, we had the best outcome because of the kind of guy he is, the kind of man he is, and the kind of surgeon that he is.
Before we even start the surgery on the patient, we actually review the plan. The 3D analysis that was obtained from the CAT scan allows us to see the knee in real time. And this allows us to see the orientation, the alignment, and actually the size of the implant that we'll use. So I can actually look with 3D technology to see exactly what the implant looks like, the alignment, the rotation. As we get into the surgery, I can actually make adjustments in surgery to balance the ligaments inside of the knee as well. So once we place these pins into the bone, we attach what we call arrays to the pins. And this allows us to consistently always know the position of the bones at all times. Once we register both the patient's anatomy and register the robot, then the next step is to actually begin the surgery itself. So I can slowly chisel away the bone that's necessary. When I look at the screen, the green data tells me the extra bone that I must remove. What's critical is this robot will not allow me to go outside of the plan that we've instituted in the very beginning of surgery. The surgeon is actually still doing the surgery. The robot is just allowing the surgeon to do it in a more precise manner because the robot will not let me deviate from the plan at hand. Then the next step is to trial or place the implant to see if it fits correctly. And as you can see, it's perfectly aligned, the rotation is perfect, and as a surgeon, it's very exciting to see that we can do this reproducibly, consistently, and do it successfully. This technology allows us to do surgery with the smallest incisions possible. Our patients are recovering much quicker than the traditional approaches.
Lauren has a question for Dr. Hobar. After a breast augmentation, will I be able to breastfeed?
That's one of the reasons I like going through the armpit, under the muscle. I'm really not going through breast tissue at all. I'm going completely behind the breast and completely behind the muscle. So it has zero interruption of any of the ducts, zero scar tissue within the breast, and there absolutely is a normal ability to breastfeed after that.
the second year that Forest Park has been out here at the Zero Prostate Run. And it means a lot to us to be here, being a new facility that's opening up in the Austin area. And our sponsorship with a lot of the doctors in the area, especially with urology. The importance of this event in spreading the awareness of prostate cancer and the need for screenings for men is extremely important. And being able to be a sponsor here and be able to help spread the word is extremely important to us.
We have a certified 5K run, a 1-mile fun walk, and then new this year we have a 200-yard superhero dash for dads for kids under 12. Every kid that runs in the superhero dash for dad gets a Zero superhero cape. So the goal is to get kids to talk to their parents about prostate cancer and about cancer in general. When somebody in your family is diagnosed with cancer, it can be very scary for a kid. So we want them to feel like this is something that parents or their grandparents or their uncles or people in their family with prostate cancer, that they can win this battle against prostate cancer. And this is what they can do to help support their family member by coming out and running in a race like this.
I'm out here today in support of the men who have the diagnosis of prostate cancer. I'm here for myself because I have the diagnosis of prostate cancer. The turnout today was greater than I expected. I think we have more than 500 people here. I was particularly impressed with some of the shirts that I saw, not just the Zero Prostate Cancer Run Walk shirt, but people that had the shirts that say Walking for Dad and with Dad's name, or Granddad and with Granddad's name. That kind of hit home.
We're really excited about the opportunity to participate with the Zero race because it's an opportunity to allow everybody to know more about prostate cancer, how prevalent it is and how important it is to really look into, make sure that you won't have problems with that down the road. The turnout's been great. It's actually our largest turnout in the 4 years we've been doing this. It's given us the opportunity to raise a tremendous amount of money.
It's really good to see other survivors because we all have our story, and then also to see other survivors' families and kind of connect.
Oh, it means a lot to me. It means a lot to my patients and their families and our families to get together in support of this cause. Even my kids today, they told me what we were doing today, and I didn't have to tell them. They knew why we were running today. And so it's a great cause. They had the dash for the kids today with these capes that they've never done before, and it was just a great sight. I'm excited for Forest Park to be a part of this as well. We're blessed with great weather. I mean, it couldn't be more perfect out here, and a lot of great sponsors and music and food, and it's just perfect. I mean, it draws more and more people every year, and that's our goal, is just to raise awareness.
I hope that everybody who has prostate cancer can feel better.
Lodging provided by Radisson Hotel and Suites. Didn't find the doctor you were looking for on today's episode? Head to our website, bestdocsnetwork.com. There you can browse through our doctor specialty gallery. Best Docs Network is helping people find the right doctor and bringing medical education to you. So long, Austin, and we will see you next week.